Our speaker today is Dana Carter. She is the director of the Center for Wound Care at Longview Regional Medical Center, and that's wound healing and hyperbaric medicine. She has a background in marketing and business administration. She opened the Wound Care Center back in 2015. The Center for Wound Healing and Hyperbaric Medicine at Longview Regional provides hyperbaric oxygen therapy and specialized treatments for wounds. Under Dana's leadership, the Center for Wound Healing won the President's Circle Award for distinction in good quality outcomes and patient satisfaction. Please help me welcome Dana Carter, please.
All right, Dana.
Okay. Can y'all hear me? Okay. I usually talk loud enough where I won't need this, but we'll try it out today. Okay, so I have PowerPoint. I really kind of like to keep things a little informal, so it's short. The stuff that you have on your table is yours to take with you, and I have bags full of goodies that if I see people starting to doze off, I have chapstick and things to just start chunking at heads or whatever I need to do. So, anybody been to the wound care center, been to a wound care center, know what we do at a wound care center? Shaking heads, yeah, okay. So our typical patient is not the, I skinned my knee and it's, put some Neosporin and a Band-Aid on it and it heals on its own. Those are not the people that we usually help. We're there for the ones that, for whatever reason, their body's not doing the natural healing process on its own and they need a little extra help. So the doctors that are in our center, we have a panel of them, and so depending on the type of wound that the patient has, we assign them to a different physician that specializes in their wound type. So Dr. Witt, Mark Witt is our podiatrist, and he's actually our medical director. He is fantastic. He works on Friday mornings. I don't know if any of y'all know Dr. Witt, but he thinks pretty highly of himself, and we think pretty highly of him too. He's really good at what he does. Ryan Peavy is a surgeon, so whenever we get those patients that are maybe been in a nursing home and they get some pretty extensive pressure ulcers from being bedbound for a long time, or they maybe have an abdominal infection that gets out of control, Dr. Peavy is the one who usually steps in on those big, extensive wounds because, number one, he's not scared of them, and two, he can take them back to the OR if they need to. John Wright, I don't know if any of y'all know him. All of these doctors are part of Diagnostic Clinic of Longview, the group. Dr. Wright's been in family medicine for, I'm going to date him, probably 50 years. And he is now going to retire from family medicine and do wound care exclusively. So he's really just dove headfirst into that and he's loving it. Dr. Lundy and Christine Moldsmeyer are supervisors of the Hyperbaric Chambers, which we'll get into, and then Dr. Mitchell's been doing wound care for 13 years. So we've got a really good team, and if you were to call, or if a family member of yours was to call and say, I need some wound care, here's what's going on with me, then we'd ask some pretty lengthy questions of what's going on, where's your wound located, how long have you had it, and then pair you up with one of these providers based on what that wound would need to give you the best chance at healing. So the top right picture, and then here on this poster, that's a hyperbaric chamber. We have 2 of those in the center. And then the picture there on the screen towards the bottom, that's what one of our exam rooms looks like. We have 2 others that have a different type of chair set up, but that's what the normal rooms look like. The hyperbaric chamber is, it's a tube, essentially. You slide into it on a gurney. They shut the door behind you. It pressurizes. You have to clear your ears, kind of like you're in an airplane. And then you just lay there and watch TV or take a nap or whatever you want to do for about 90 minutes. And the reason that that's helpful for a patient with a wound, so right now on room air, you guys are breathing and your red blood cells are taking oxygen to your tissue. If you had a pretty bad wound on your foot or an extremity that's not getting great blood flow, sometimes that's not enough oxygen. So when you go in the chamber under pressure, then your plasma will also carry oxygen to that tissue, and it's just super saturated, and that wound will heal twice as fast as not doing in the chamber. They come and they see us Monday to Friday for 30 treatments, so it takes about 6 weeks. They'll come every day and spend about 2 hours with us from the time they get there, get dressed, get in the chamber, do their treatment, and get them, back into their street clothes. They're breathing 100% oxygen in that chamber, so they can't have any makeup on, no deodorant, no hair products, no aftershave, nothing that would have an alcohol base to it. They can't bring their cell phone in, they don't bring their own clothes in. They go in their birthday suit and a hospital gown. They use our linens, everything is really controlled for safety reasons. So that in that area of the center, we don't let just anybody walk back there. We don't let but a certain set of housekeepers in that area. It's very strictly controlled on what goes in the chamber and who touches the chambers and what happens to them. Y'all feel free to stop me if you have questions, okay? So, what kind of wounds do we treat? Everybody done eating? I told them I took all the gnarly pictures out, and I guess there's still some, but this is mild by our standards. Okay, so probably half the patients that we see have diabetic wounds. So the handout I left on the table for you is specifically about how to take care of your feet if you're diabetic. But this would be beneficial for anybody to look at for foot care in general, because diabetic or not, these are the best ways to care for your feet. So half the people we deal with are diabetic, and so we give them a lot of education and work with them quite a bit. They've got several things that the diabetes compromises in their wound healing. So they're probably our most time-consuming patients, is just helping them to get those issues relieved so that the wound will heal. Venous stasis ulcers, that's kind of like the one on the right. And basically it's the blood makes it down to the foot through the arteries, but the venous system is compromised, so it's not coming back. They get a lot of swelling, a lot of like little skin tears and breakdowns that just won't heal. Those are hard to heal. They end up in the wraps and compression. If you ever see people that look like they basically have a cast on their legs all the time, the pumps at home and that kind of thing, those are the patients that are getting those. A lot of surgical wounds, C-sections that maybe the mom was a smoker once upon a time, and so she stopped smoking for the baby, but her blood vessels are still compromised. We get a lot of surgical wounds. Arterial wounds, those are more difficult. We work with Dr. German-Walla and Grafenkamp a lot to get these blood vessels cleared out and prepared to be able to heal that wound. If there's no blood flow to the area, we're just throwing more and more dressings and medicines on it. Radiation injury. This is a really common one that people don't really think about when they think about a wound care center. The Texas Oncology sends us a lot of patients that maybe had prostate cancer or breast cancer, and they receive radiation therapy for the cancer. They don't come to us with cancer most of the time. It's 6 months, 2 years, 5 years down the road, and that radiation therapy damaged the soft tissue around the area where the cancer was. And so they live with a lot of times internal bleeding and a lot of pain and discomfort for a long time. And if it goes on past 6 months, past the radiation, you can grab that Brinkley, it's okay. If they go on past 6 months, past the radiation, experiencing those symptoms, a lot of times they've got that soft tissue damage. And the only thing that will heal that is going in the hyperbaric chamber. So most of those patients who survived the cancer and they beat it, sometimes they suffer after the fact with the side effects from the treatment. And they just accept that as the new normal, and it doesn't always have to be their normal. So we see a lot of men that had prostate cancer, and they just accept the fact that now sitting will be short-term and they can't do as many things as they used to do. I would just encourage them to come give us a call and let us see if that's what's going on and if we can help. A lot of them are able to get off the pain medication, resume their normal activities of their life, and so that's a big life changer for them. Pressure ulcers, that's your patients that are more bedbound or in a nursing home, or they're very overweight and they're kind of confined to a wheelchair all the time. They end up with pressure points either from the chair or from the bed, and so we work with them. Trauma, and see a lot of snake bites and spider bites this time of year especially. And then minor burns. Gosh, we see a lot of burns with people like throwing gasoline on fires, which you think people know not to do, but we see a lot of that. So this is just a short list. We see a lot of different things. So the diabetes is probably one of the things, you can't really control trauma, you can't really control that a snake came out and got you, you can't necessarily fix your blood flow issue on your own overnight. But diabetes is something that we can control and something that we can lessen the effects of ourselves with our own diet and our own maintenance of it. So I'd like to talk about that a little bit. 11.2% of the adults in Texas are diabetic. We are not the highest percentage state in the country, but by far the South has the highest percentage of diabetics. Diet, education level, exercise, all contributes to that, but it is increasing instead of decreasing, which is disappointing, but that's the case. 3% of those diabetics will then get a diabetic foot ulcer every year. And then 25% of those diabetics will get a diabetic foot ulcer at some point in their lifetime. And then of the people who get a diabetic foot ulcer, that will be the most common cause of amputation, whether it be of a toe, a foot, below the knee, above the knee, of all causes of amputation that there are. So it's sad to hear that somebody might lose a toe or a foot or part of their leg for something that could have been controlled with medicine or better diet or better exercise. So we really work with them and encourage them on working with their primary care doctor and keep that under control, because the longer it goes with the high blood sugar levels, the more they'll have nerve damage. And that's neuropathy is what you'll hear a lot of people say they've got neuropathy. They lose sensation in their feet. When they lose sensation in their feet, they'll walk around barefoot, step on something, never even know it happened, get a small little cut, then they've got compromised blood flow and they can't feel it, and before they know it, they've got a full-blown ulcer that only took 2 to 3 weeks, and it's the whole bottom of their foot. So diabetes is really dangerous, and for somebody with uncontrolled blood sugar levels, it's even more so. So how do we treat these different types of wounds? So when they come to us, if there's dead tissue in the wound, they're going to remove that first. That's where those surgeons and podiatrists come into play. They're going to culture it, make sure there's no infection. They're going to make sure there's blood flow to the area. If we don't have blood flow to the area, we're just throwing money at it. It's not going to do any good if you don't have good blood flow with good oxygen to the tissue. We're going to do offloading techniques. Offloading is just removing the pressure. So if they're sitting a lot, we're going to encourage them to change positions, lay down some, walk more. A lot of education on nutrition. Work with their home health nurses so that you've got some reinforcement at home. They'll come and see us once a week in the center at least, and so if you're only seeing me on Monday you're going to do great. And then Wednesday or Thursday you're kind of like, what now? That pie looks great, or what, So having home health in the picture and having family on board and everybody kind of talking the same talk really helps a lot. Doing some lab work, make sure that there's not some other kind of deficiency that's contributing to why the wound won't work. Compression for the venous wounds when we need to get that fluid out of the leg. We do some really cool bioengineered tissues. Basically, that's amniotic skin cells from ladies that had C-sections that were elective. They take that amniotic tissue from the placenta and they make a skin substitute out of it. You put that on the wound, and in 2 weeks, it's healed. It's really amazing. Wound vacs, the chambers, more education, and then really expensive, high-end specialty dressings. So we don't throw all of this at every wound, but every wound gets a lot of this. And it just kind of depends on what's going on with that patient and what's going on with that wound and what do they need. And we come at it from a lot of different angles. So by the time somebody makes it to us, we're going to assume that the normal measures didn't work, and we're going to go all at it with the whole toolbox. So, do you have any questions? I'm talking a lot. Everybody's nodding. Yes.
Yeah, so this hyperbaric is in Longview,
Yes, sir.
and is it an independent clinic or is it part of a hospital?
We are a department of Longview Regional, but our clinic is not attached to the hospital. We're in a different building. I don't know if you're familiar with the campus, but the 802 building that's kind of across from the ER entrance, we're in that building on the 4th floor. And so we're under the umbrella of Longview Regional, and all of the accounts and the testing and everything are done through them. But yeah, you don't go into the actual hospital.
Yeah, so how long have you been doing hyperbaric there at Longview?
Our center, I opened the center in 2015. So we've been there for a little over 3 years. The Good Shepherd Clinic was there for about 10 years before, but it was the only option around here other than having to go to Tyler or to Marshall.
Okay, so in other words, hyperbaric is all around the country more or less. It's like they do them in Tyler, and Dallas has got a bunch of them, I guess, or something.
Yeah, it's so hyperbaric medicine, it started with scuba divers and the deep sea diver group. It's the Universal Hyperbaric Medicine Society that actually started the process. And they did it for the divers that would get the bends when they'd come up too soon, then they'd put them in this chamber to help reverse that sickness. And then what they saw is that there were other benefits for it. So no, we didn't invent the medicine, but and it is available around the country. It just kind of depends on the physician on when they would use it and when they wouldn't. Yes.
Can you explain the makeup and the antiperspirant and plum? What's the deal with the oxygen?
Yeah, so when you go into the chamber, it's they're pumping 100% oxygen into the chamber, and oxygen's flammable, and so they don't want anything else that could cause any kind of a spark, an alcohol base that would have any friction with the bed going in and out. The makeup thing may be a little bit overboard, but if they're doing it, it's because somewhere somebody had an issue. There have been stories of people going in with like hair clips in their hair and metallic things scratching and it causing a spark. If you're in the chamber and something sparks, it's not good. Yeah. So they come in, no makeup, no hair products, no aftershave, no deodorant. They don't bring their own clothes because you don't know what kind of clasps or zippers and all that. So. A lot of safety precautions. The other thing I'll add is, so our brain is not used to having just oxygen. You know, normal air around us has nitrogen and other things. Your brain gets used to that. So when you're in the chamber, you don't necessarily notice it, but it's you can get oxygen toxicity, and it's kind of like a drug. They get high. And so they take breaks where we'll cut the oxygen off and they breathe through a mask, and it's medical grade regular air for 5 minutes, and then go back to the oxygen and then back to the medical grade air. And that way your brain doesn't get confused during that 90-minute treatment. So they've got the science written down, you know, to make sure that it's helpful. We get the patients who are claustrophobic, and you're in the chamber, and they put you down under pressure, and once you're down, you're not coming out. You know, it takes about 10 minutes to depressurize the chamber, and so we have to keep them calm. There's a lot of coaching that goes into that. Am I running out of time? 3 minutes. Okay, so I have some t-shirts to give away. If y'all have some more tickets you want to draw, I have 3 t-shirts if y'all want to do that.
How do you want to do it? Or just keep the tickets that they
Yeah, if they've got tickets.
They have.
I mean, I feel like he won $400 and something, so he shouldn't get a t-shirt.
Well, the only thing is we threw away all the draw. I'm sorry.
Oh, okay, well, so let's do this. What is,
Do birthdays.
do what? Oh, the birthdays? How about this? Let's see how good everybody was listening. Uh-oh. What percentage of diabetics will get a wound in their lifetime? Ding, 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 she got it. Get you a t-shirt. 25% will get one in their lifetime. 11% of Texans are diabetics. So y'all had your numbers close. What else? Let's see. So, this is one we didn't even cover. What's the best time of day to buy shoes?
Early morning.
I knew a woman would say that. Who said in the evening? Yeah. Do you know why?
Because your feet are expanded.
There you go. Your feet swell. So especially for diabetics, if their feet swell and they buy their shoes too small, they're going to get wounds. I'll pass that back to him. Thank you. And what else? Okay, who is our medical director and podiatrist?
Second name. That's a P.O. Dr.
Whit? You got it. Okay, there you go. Last thing I'll say, if anybody has a wound or a family member with a wound, you give us a call. Our information's on everything, but encourage them to watch their blood sugars, make sure the wound doesn't get infected, that they have good, adequate blood flow, that they're working with a cardiologist to make sure that the blood can get to that area, that they don't smoke, don't use drugs, don't drink alcohol. That'll all slow the healing or completely eliminate the possibility. And that they get in with their primary care doctor so that somebody can be taking a look at it. Any other final questions? Yes, sir.
What is the pressure? In other words, your whole body's pressured up, right?
Mm-hmm.
Or the whole chamber's pressured around you.
Yes.
What is that pressure amount in numbers? How many?
2.5 atmospheres is what they usually do. It's the equivalent of being 33 feet below sea level. It's slow. It happens slowly. It takes them about 8 to 10 minutes to get to that depth, to that pressure. They don't have, so let me clear. They don't actually go anywhere. There's no depth. And they call them divers, but there's no water. It's just as the chamber pressurizes, it's like they're lowering below sea level.
Okay.
Thank you very much.
Good job, Dana.